Hi, I'm Farah Myers, family nurse practitioner and owner at Cool Creek Family Health, and I wanted to talk a little bit about checking your blood pressure at home. I have a lot of patients that we do a lot of ambulatory monitoring where they're going to check their blood pressure at home. Just makes it a lot easier. Don't have to make it a visit every single time, but a lot of times they're not sure how to do it. So I'm going to show you how. First things first, you want to make sure that when you're measuring your blood pressure, you have an empty bladder. Having a full bladder can increase your blood pressure by 5 to 10 points. So we want to make sure that we've gone to the bathroom and that we do that before we sit down and take the blood pressure. All right. So next things is we're going to sit down for about 3 to 5 minutes. So that's going to give our body a chance to kind of just calm down and get our blood pressure down. When we get up and we're moving around, our blood pressure is up and higher. So we want to give it a chance to calm down. So 3 to 5 minutes is what you're going to sit down before you want to take any of the blood pressure measurements. Other important things, you want to have make sure your back is resting in your chair and your arm is nicely rested. And both feet are on the floor. So do not cross your legs when you're getting your blood pressure measured. All right, so you're going to take this, and we use a wrist cuff. They can be pretty reliable at home. So you're going to take the wrist cuff and you kind of put it on there, and you're going to put the measurement on the inside. The other thing you want to make sure is that your cuff is level with your heart when you're getting this measurement done. So then you're going to take it and you're going to start it and you're going to cross it over your arm, and you're just going to kind of relax. Make sure that your hand isn't tensed, your wrist isn't cocked in any way, and so that's nice and relaxed when the blood pressure is getting run. And then also the last important thing is make sure nobody's talking to you and you're not actively listening to anything. So no watching TV or listening to a podcast, or if your spouse comes into the room, tell them to zip it for a little bit. So you just want to make sure that all of these things can contribute to high blood pressure measurements. So that's it. You get your blood pressure measured and then you're good to go. Record it down, send a couple measurements over to your primary care provider, and then we can help you to make sure that your medication management is where it needs to be, or that you don't need to be on anything. Some people have higher measurements in the office, so this is a really good way that I use with my patients in order to make sure that their blood pressure is normal at home, even if they're a little bit nervous in the office. I hope this helps as an opportunity for you to learn how to best measure your blood pressure at home. And thanks so much, and thanks for tuning in.